All right, we are continuing our conversation this morning about annual enrollment. This is a very important time for seniors. We're joined once again from the MyCare Medical Group. James Dubray is joining us, VP of Sales and Marketing. Always a pleasure to have you joining us, James. Good morning.
Good morning, Carly.
So of course, healthcare important for a lot of people, but certainly our seniors. And I know that is the passion of you and your team. That's what you specialize in. Talk about how important it is that seniors make sure that they are getting the care and sign up for the care in the doctor's office that they really want to be a part of.
Absolutely. Look, this is the perfect time to go scout out your doctors, do some interviews, meet the staff, check out the centers. Don't just pick a name out of a book or look at a picture in a book. Go and see and interview and talk, because a lot of what is going to happen, particularly with MyCare doctors, we're going to talk to you about your particular healthcare need and try to build a customized plan. And that's what you really want. You want someone that's going to look at your particular healthcare issue and build something that's customized for you. And so that's what you're going to want to do. And we're going to we have a lot of open houses and a lot of events where you can come and visit us. But please take advantage of this annual enrollment period to go and check out some of the facilities before you select your doctor.
All right, so you have locations all over the Bay Area. Talk about some of the doctors that are on your team there. And, again, I just know we've had a chance to visit with a lot of them, and this is their passion.
Yes. Well, our doctors have been with us all for quite a long period of time. And I started to try to figure out how long, but I'm just going to say long, because what we do is we actually take care of our doctors and pull away all the administrative stuff that they normally would do so they can focus just on clinical health care. And as we make those doctors happy, it's easier for them to translate into making sure that the patients are happy. And so our doctors on average stay longer than anybody in the industry. And it's because we really take a really hard critical look at how can we reduce the minutia that they have to do and let them focus only on clinical health care.
I love that. The Bay Area is certainly a very diverse population as well. Talk about that, how that reflects back to your doctors. And I know a number of them speak many different languages too.
Absolutely. So, yeah, that's one of the things that the last thing you want to do is go to a doctor's office and have someone translate for you in a different language your medical condition is. So we have English, Spanish, Chinese, Creole, French, Gujarati, Hindi, you name it, almost any language that you can name, we have. And because it's important that you communicate in the language of your native language so that you can understand what the doctor's saying in terms of your health. Absolutely.
Talk about what the patients are saying about you and your team too. And I know there's all sorts of different ratings you can look at. Talk a little bit about what MyCare Medical is seeing.
Wow, that's a great question. You always have great questions. Listen, what we do with our patients, we do something called a Net Promoter Score. We ask our patients, would you recommend us to a family member or a friend? And based on that response, that's how we look at our rating. And so we actually rate in the high 80s. And in terms of the industry, that's top class. That's at the top of the class. So we constantly do our research around how can we get better? What else can we do? How are you feeling about each visit? And we want you to recommend us to either a friend or to a family member, because that's the best kind of referral and it's the best kind of patient when someone's saying that doctor is excellent, you should go see him or her.
Oh, I love that. Hey, talk about meet and greets. I know the last time we checked in, you were working on one. You're working on another one this week, and this is what you're going to continue to do through annual enrollment.
That's exactly correct. Listen, food insecurity is one of the things I've been talking about. We are going to have a plethora of events around food insecurity. And every time I'm on here, I'll talk about an event that has to do with food or where you can come meet our doctors. On Thursday, 10/29, we're going to be in Pinellas Park at Bedrock Lake Bonbon, which is 6190 67th Avenue, Pinellas Park. We're going to have food. We're going to have events. We're going to have staff there. Come by and see us. And listen, if you have any thought about how to meet us or how to come see us, visit our website, mycaremedicalgroup.com. Call that number. Someone will answer, and we'll be glad to help you. You can actually sign up for a tour, or you can sign up for an appointment. We have multiple ways for you to reach us, and somebody will respond. I guarantee you.
Well, James, there is the website there, the phone number to get more information. Always a pleasure talking with you. Thank you for everything that you and your team there do. We appreciate it.
Well, thank you, Carly. I am, as you can see, I'm very excited. This is an awesome time of the year.